Hey everyone, it's Tremia, and today, excuse me, I'm going to be talking about lung disease. I'm finally getting my answers and everything. Yeah, I've been working on getting into the right doctor and the right treatment since March. Although I know my lung capacity and everything had been diminishing since November. But since March, that's been 6 months already, that I've been trying to get this all worked out. And I think I finally found a doctor that we work well with. She's really nice and knows what she's doing. And so far, so good. Okay, she gave me 3 diagnoses. And they are asthma. Boy, that was a loud bird. Okay, asthma, interstitial lung disease, and restrictive lung disease. And we all know what asthma is, or somewhat, but these are what I'm on right now. It's Flovent, and it's basically just like Advir, and it does have steroid in it. So I have to be really careful. My eyes are watering. I have to be really careful and wash out my mouth well afterwards because, I'll get the candida in my mouth. And she says to make sure I use as hot as water as I can, and if I do start to get the thrush, the candida, to make it salt water and use salt water to rinse out my mouth. But ever since I got that Candida esophagitis, my stem cell doctor here has had me on diflucan, and I take that daily. So hopefully that'll help me, not get candida again. And then the other one is just Ventolin. And I said, well, I don't like Ventolin because it makes me shaky. And she said, well, just do 1 puff instead of 2. And I said, that's why you're the doctor and I'm not. Never would have thought of that, such a simple thing. And she goes, then after a while, you can build up to 2, your body will get used to it. So I do that. I do the Flovent twice a day. The Ventolin, I think every 4 hours. I can use it every 4 hours a day, but I just use it as needed. I started on Pulmonary Rehab last week, and it's outpatient. And it's been hard. It's been making me sleep like a baby, at least. I go in and they automatically, it's cardiopulmonary rehab. They hook you up to a heart monitor, so they got your heart rate going. And you do different exercises, walking, biking, that thing that goes like that. Exercises with bands and stuff, and after each exercise, they take your blood pressure, and they're automatically got your heart rate, and they also do your O2 sat. And I'm usually in there like an hour and a half, and it's tiring. I make it home and I make it to my bed and lay down and I sleep the rest of the afternoon. I made it so like by the time I finish, it's time I can get home and I can eat some lunch, and then I fall over asleep. And then so I'm doing good time management for myself. But I was wanting to talk about the lung diseases that they diagnosed me with. And we'll start out with restrictive lung disease. That's what I have some. Restrictive lung disease causes reduced lung volume. Let's say, she said like your lung's a balloon, and you can fill it this full, and you blow it that full, and and it goes like that. But mine is restricted, and so like I can only get so much oxygen in my lungs, and that's why I have shortness of breath. And so it causes reduced lung volume. I have my notes. And reduced total lung capacity, which basically to me is the same. You can only get so much oxygen in there. And it's caused by intrinsic lung diseases, which cause inflammation and scarring or pneumonitis, which also can be caused by connective tissue diseases like lupus or drug-induced lung diseases like lupus. And it's just like, it's all related to lupus. The lupus in my body caused these diseases. Also, like, the symptoms of restrictive lung disease is progressive exertional short of breath. That's how I was talking about, like, I can only walk so far, and then, that's it. It's not that my legs won't take me that much further. It's my lungs won't take me that much further. And so the progressive shortness of breath is also, restrictive lung disease. Also, it can be caused by neuromuscular myopathies, which the steroid myopathy has caused, also part of this. So I've got a lot of different things causing this restrictive lung disease. So far I have the lupus, the steroid myopathy, just any of the connective tissue diseases. Also, another common symptom of the restrictive lung disease is a dry cough, not a productive cough, in which I have that, off and on, except from this last week after they really started these exercises to expand my lungs. I've started to cough up, have a productive cough, and it scared me because when I got ready to go Monday morning, when I got up, because I'm not used to having a productive cough, and it was pink tinged, and that scared me. And they said that it's not uncommon. Like, if it becomes bloody, like profusely bloody, then we need to get into the hospital and figure what it is. But right now, that sounded like a gunshot, but it wasn't. I think it's somebody's car door. It's pink tinged, which means like it's breaking up some of the inflammation, and it's just causing some bloody, just light pink, sputum. And vasculitis can also cause restrictive lung disease, which vasculitis is what I'm fighting. That's what I'm taking the Cytoxin for. And my rheumatologist and also this pulmonary doctor said hopefully the Cytoxin will help this too, because I've got vasculitis everywhere else. Why would it not be there in my lungs? But the only way to determine that is to go in and to do a lung biopsy. And we decided, that was too invasive, and I don't want to do that if I don't have to. It's like, if, the medicine helps, it helps. And then chest pain is uncommon, in which I really don't have chest pain, but I do have pleuritic pain, which is common in restrictive lung disease if you have systemic lupus. So everything that, like, restrictive lung disease in there, it matches my symptoms. Okay, the next thing is interstitial lung disease. I've got my computer because I want to make sure I'm telling you guys right. Interstitial lung disease is caused by inflammation of the interstitium of the lungs, and the interstitium is the tissue that surrounds the air sacs in the lungs. And interstitial lung disease involves an inflammation of the supportive tissue between the air sacs rather than inflammation in the air sacs themselves. Interstitial inflammation is typically a diffuse process that occurs all over the lung and is not confined to one location. And she said that mine right now is just at the bottom of my lungs, and going back through years of like x-rays and all that kind of stuff, it hasn't really progressed further. And she said that the plaque 1L has kept it from progressing. So yay for Plaquenil. You know, sometimes I've always wondered about Plaquenil, but it has been doing something for me. So thank God, because interstitial lung disease, it can lead to lung transplants. But mine is staying down at this, it hasn't affected all of my lungs, just the lower parts. And it says also, like, infections can cause it, which, you know, I had the real bad bout of pneumonia, which I had the respiratory failure and all of that in 2009. It also says chemotherapy, and it names Cytoxin, which it can cause interstitial lung disease. And that's, you know, I've done Cytoxin. I did it for 3.5 years prior to the transplant, and I did it every 2 weeks for 3.5 years. And then for the transplant, I did it in, you know, massive doses. And then for the last year, I haven't done any, but I just did I'm getting ready to go in for my second round of Cytoxin next week. So it says that it can do that. And connective tissue diseases such as lupus, scleroderma, and rheumatoid arthritis can also cause interstitial lung disease. Now, the thing about all of these is that they don't lower your blood sats. And that was one of the first things when I went into this cardiopulmonary rehab. I said, you know, they test my blood sat, and it was like 91. I said, okay, you know, explain this to me, because it seems like everybody has the opinion, except not my doctor here, not my rheumatologist, but it just seems like when you're in the ER or you're in the hospital for something, they say, well, your sats are doing fine, and, you know, and you're sitting there, you know, your lips are turning blue and you're, you know, gasping for air, and they're saying you should be doing fine, and it's like, well, I'm not. And they say, no, your sats do not have to do with every kind of lung disease. Like with COPD, yes, SATs is a major part of that disease, and that's what they watch on that. But what I have, it's not a part of that. And you know, it's a good thing that my SATs are high. You know, it puts me, you know, one up. If it starts to fall, then we're going to have some other problems. So my SATs are doing good. So the the pulmonary rehab, I think it's really gonna be helpful. It's gonna take time. I go 3 times a week, Monday, Wednesday, Friday. You know, I'm gonna have increased energy. You know, it's gonna help me with my muscles. They're gonna help with weight loss to help breathe better. They're gonna, you know, help with the expansion of my lungs, and, you know, they're gonna help me with education and everything else on lung disease. So it's a good thing. And I don't know whether this has been bothering me, and it's been for over a month. I had somebody come in on one of my videos and leave a bad comment, and which is uncommon. All of my subscribers and friends, you all support me and have helped me through one of the hardest times of my life. And for somebody to come in and to hate on me, and you know, it was hard, and I deleted the comment because I didn't want everybody else to see it and to get upset or to hate back, or to, you know, I just didn't want to cause an uproar. But I can't let go of it, because I responded to her privately, and then she responded back, and it was even worse. And you know who I'm talking about. And I won't tell you who it is, but they're talking about, she says, I find fault in the, she said, I find fault in the subtle things, telling viewers you're short of breath and have oxygen on, and then breathing through your mouth, not even using the oxygen on your face really. When you thought you'd beat this disease and you didn't know you still had it, you were walking and trying hard to get yourself together. And as soon as the doctor told you you still had lupus, you went downhill real fast. Something that seemed evident to me and my husband, who both watch you, is that you only knew how to identify yourself as someone who is sick. So do I think you want to enjoy your lupus? Want or enjoy lupus? She says absolutely not. What I think has changed is your tone, that you enjoy the attention your channel gives you. The attention you get is what is addictive. I do believe that it can happen to anyone. Tremia, it is easy to become addicted to attention. Look around at all the gurus. I haven't heard a positive thing on your channel that didn't involve gifts or vacations. That's a Debbie Downer. I know now after rereading my comments, I'm not crying, my eyes are watering. She goes, I come off abrasive. It wasn't my intention to be an a-hole, which I say I sounded like. I'm just very assertive with a side order of a no brain filter. And I'm going to stop that there because it goes on. For one, okay, I do not seek self-pity or attention, or my goal is lupus advocacy and the life in lupus. And I show you the good, and I show you the bad, and I show you the ugly. And I do have shortness of breath. What I've come to learn, not every shortness of breath is the same, and apparently other people need to learn that too. I can have a cannula on, and they said that they're thinking about start putting me on 24/7, but once you go on that, it's hard to wean off, and it can also cause the disease to worsen. Yes, you can have a cannula on and breathe through your mouth. It still pushes oxygen down through the back of your nose down into your lungs. You don't sit here closed mouth breathing through the cannula. And also, if your nose is stopped up, which my nose is stopped up a lot, sometimes I do have to go like that. And when I can't breathe low and I'm gasping for air, I don't gasp for air through my nose, I gasp through my mouth. And I don't seek attention from others. My life, unfortunately, is secluded. So when I do get a letter from somebody, it does make me happy. That's me. That's Tremia. And I'm sorry if that offends you or if that offends anybody else. But I'm not seeking anybody to send me a card. What I do, the videos I make about around the globe, that is not me you know, asking for gifts or anything. That is something two other dear friends with lupus on YouTube, they started, and they send out gifts to people with chronic illnesses. They both have lupus, I have lupus, and then once you receive that, you put a gift in. They ask you to make a video, they ask you to post it to YouTube so everybody can see where the gift's going, and then you send the gift off. I've been fortunate and blessed to receive a lot of those because it makes my day. It does. It makes me happy. That I bring out publicly because they ask me to, they ask specifically, you know, to put it on YouTube. There's times when I send gifts to others or I receive gifts from others that I keep it private. And, you know, we thank each other and talk to each other behind the scenes because it's our friendship and it's private and it's something special. And, you know, it's something that we protect and we take care of. But to have somebody come and, you know, I can't be sick in the right way to make them happy. You know, I'm not breathing right. At one point in one of the deals, she says that, you know, she can't help but laugh because I'm not sick. And, you know, I wish I wasn't sick. And did I get sick all of a sudden because of, they came back and said, no, you got lupus? When I had my stem cell transplant on March 31st, 2011. May 12th, 2011, not 2 months later, my face broke out in that rash. My very first question was, is this lupus? For the whole year, I kept notes. Is this lupus? You know, this is happening. This is happening. I kept on pushing myself. I was making myself worse. And, you know, yes, I was out walking. I still am out walking. I never quit walking. I never said I quit walking. I do my recumbent bicycle, but I can only do it so far because I can only breathe so much. You know, I do that. And I do what my body says I can do. And when they come back and said that it was lupus, I wasn't automatically sick. Dwayne and I walked around in shock for probably a month before we told anybody. Because we've worked so hard and we fought so hard. And I had been saying, okay, Dwayne, do you think this could be lupus? Okay, Dr. Burt, do you think this could be lupus? Asking my rheumatologist, you know, could this be lupus? Because, you know, the symptoms were coming back. You know, the mouth ulcers, you know, the rash was, of course, there. But they were denying that that was lupus. You know, the shortness of breath, my hair, you know, falling out, my blood, you know, this and that, all that kind of stuff. No. And I don't think my doctor really wanted to admit that it was. But we knew going into the transplant I had a 50-50 chance. And unfortunately it was the wrong 50. But I have come out better. I do not think I seek pity. I'm fighting, and this battle's going to be won. When January, February, March, when I was having trouble with depression and anxiety, I was open and out front with that, saying I don't know, you know, what's going on, something's wrong. I'm tired of waiting for answers. You know, we can't get answers. You know, I told everybody what was going on and where I was at physically and mentally. And so for somebody to come back and just to basically slap you against the face, and this has been a subscriber, one of my very first subscribers, and it's like, you don't need to come and talk that way on my channel, and you don't need to come and treat me that way. And if I come off that way to anybody, I'm sorry, that's not my intention. And I fought hard not to speak back and to have to explain myself to this person, but I'm answering it, and that's done and over with. She's no longer a part of my channel, and she's no longer welcome. And you know, if her and her husband's activity is to sit and to laugh at how I breathe, then they're not having a very fun life. And Dwayne and I, we wish them growth. We wish them the best. She's also sick and has a chronic illness, and I would never do that to another person. So I hope she does well. I'm heading in the right direction on my breathing, and I love you all, and I thank you all for being there for me, because ever since I started this channel, if it hadn't been for all of you and your support and me being able to teach what I know and what I go through, this journey through lupus would not have been the same and would not have been easy. And it hasn't been easy. So I love you all, and I'll see you in the next video.